Hello, I'm Gary Barnett. I'm the president of Sara Lincoln Health System. We're located in Charleston and between Charleston and Mattoon, Illinois, East Central Illinois. We are a hospital, home health organization, a number of employed physicians. In total, we have 1,500 people that work within the health system. Back in 2004, we were considering how we could move from being a good organization to a great organization, and we had a special committee of board members, members of the medical staff, and the administrative team that considered the various models for performance improvement. At the end of that conversation, we made a recommendation back to the full board that we thought we should start our journey to the Baldrige Award. Baldrige was selected because these 7 categories really address everything that we do, because the goal is that we take our strategic plan, fully deploy it, and then get the outcomes that were desired. And it has specific ways of measuring how successful we are in each of those categories. We, of course, have faced some challenges as we've been on our journey. One of those early on included the people that will always be a little resistant, will always be a little skeptical, will always think this is the program for this year, and if I just wait out the administration, that it'll just go away and it'll be replaced by some other program. We've moved substantially beyond that, because as we have learned more and more about the Baldrige program and have shared that information broadly, we've found that people really get very enthusiastic about how the program works. Another challenge that we faced, of course, is this is a more vigorous program with higher expectations than anything we've ever done before. It asks very challenging questions, and the expectations are high. Excellence is a term that can be used very easily, but it's very difficult to demonstrate. And so it has been a challenge for all of us. What we've found is people are ready for a challenge, and that frequently it's a matter of asking them to raise their level of performance, getting them involved and engaged in how that's going to happen, showing them the results, and then that just builds more enthusiasm for the journey. In the early part of our journey, we particularly needed to look at our customer satisfaction, and in our case, it's patient experience is the title for that. We had a lot of improvement that needed to happen in the area of patient experience, so we've involved many teams of employees for the various aspects of that element of performance, and the scores have in fact come up across the board. We measure scores within inpatient activities, outpatient activities, and all their 11 areas that we're able to measure, and that we can get benchmark information from other high-performing organizations in order to determine our progress. In all 11 areas, we have made progress, and we're gradually increasing the standards and expectations of what we want to achieve in those areas, and we will be asking for higher and higher performance. Every month when we get the scores for the previous month, we celebrate with the management team, and then we go out to the departments where the department has had the greatest amount of improvement and the top performer, and that's an opportunity for us to celebrate the progress. We're also moving the program into clinical areas, and our medical staff is getting more engaged in the process of performance improvement and understanding the tools that we can use from the Baldrige model in order to address those areas. In total, it's been a very interesting process for us. We have a long way yet to go. It's one of those journeys that we'll truly never finish. But I've been so pleased with the reaction of our employees, our board members, our medical staff members. They're all quite excited about the Baldrige program.